Okay, next I have the pleasure of introducing Dr. Cheryl Coleman. So we have two Cheryls back to back, but we will certainly enjoy this next talk because Dr. Coleman is going to be talking about coronavirus and is that the new normal? She was asked to talk a little bit about its relationship with respite, and we hope that she covers that a little bit. Dr. Coleman is the author of the original empirically based theory on volunteer management, and she also serves at the State of Nevada Aging and Disability Services Division as a program officer, performing various functions around volunteer management, emergency statewide pandemic service delivery strategies, and quality assurance measures that explore program efficiency and effectiveness. So without further ado, Dr. Coleman, I'm going to turn the program over to you.
Awesome. Thank you so much. And thank you everyone for the privilege of being able to share with you this morning. I'm not the respite expert, but I am within the respite service delivery within the state. So I was asked to share with you all today concerning is coronavirus the new normal? And so we'll get right into that. So the first thing we'll talk about is the current state mandates. And so a lot of what I'll talk about today is going to sound like a broken record. But obviously, as the coronavirus has impacted all of us around the world, these important topics are just as relevant to the respite community. So we will rehearse current state mandates, and as we know, those are fluid. They can be changing as we see various impacts of the pandemic on our state. We'll rehearse some of the impacts of the respite care system during the current coronavirus pandemic. So we'll look at, and again, rehearse some of the things that we've talked about all yesterday, but just to reiterate that what we're experiencing here, others are experiencing it in other places as well. We'll talk about current recommendations for caregivers and providers of respite services. And so again, that's fluid, it changes. And so we do have some resources for you to stay in touch with ongoing changes that have had some impact on our lives concerning the virus. We'll talk about what some other states are doing to manage the pandemic crisis and its impact on respite, how we are able to access and provide respite care during the pandemic here in the state of Nevada. And we'll kind of piggyback a little bit on Cheryl Donnell, her presentation on loneliness, and we'll talk a little bit more about social isolation and then what we can do in the meantime. So the short answer to is coronavirus the new normal at this point would be for the short term, at least looking into the long term, yes. It obviously has made a great impact on the global society, and so I don't know, and I think this is just it's a rhetorical question. Will we ever go back to normal? I doubt that we would. I think all of us can answer affirmatively from that respect. So the current mandates for the state, we all know this will sound like a broken record today. Definitely wear a face covering. We know that it has some impact on keeping us healthy and helping us to prevent acquiring the virus as well as transmitting it. The recommendation is to wash hands often with soap and warm water for at least 20 seconds. And we know that, broken record again. Definitely be cleaning frequently touched surfaces such as doorknobs, countertops, etc., with household cleaning sprays or wipes. And this is a new one. We used to cough into our hands, right? But now the recommendation says that we use a tissue to cough into or cough into our inner elbow. And so, you know, again, that's fluid. We're seeing how the new normal, even with just coughing, is a real thing. Additionally, use alcohol-based gels that contain at least 60% ethanol. So as they say, all hand sanitizers are not created equally. There's research that reveals that unless a hand sanitizer has at least 60% ethanol or ethyl alcohol, it's not a very effective hand sanitizer. So as we're looking for overly priced hand sanitizers these days, we definitely want to be making sure that we're buying a product that contains ethyl alcohol. Avoid touching eyes, nose, and mouth. And again, if you are sick, stay home and avoid close contact with others. That's really difficult to do if we're bringing in providers who are not family members. And we'll talk more about that as well, but definitely maintain your social distancing with others. And then the other things that respite care, workers or providers or caregivers have been experiencing is you know, how to take care of themselves, kind of being that gatekeeper to their families and their loved ones, not just themselves, to prevent the spread. So definitely be thinking about recommendations to think about ahead about how to take care of yourself consistently for the short term and long term. I mean, it's here with us today, and so we definitely need to be thinking about these things right now. So think about and develop a plan as to how you'll continue to take care of yourself and your loved ones if the virus resurfaces. I mean, we've been doing really good here in the state of Nevada. I'll have some resources for you to look at later so that we can keep up with the day-to-day changes and the successes that we're having with controlling the virus. But again, be thinking about, as I know that you are, how you can make sure that you're taking care of yourself, your family, and those who you come in contact with. So impacts to the respite care system during the pandemic. These are some of the things that we have found that caregivers are experiencing, as well as providers, but I think primarily we're talking about caregivers today for the most part. These are things that folks are experiencing, and perhaps when we go into the breakout session, we will learn more of what folks are experiencing, but this is just for the purpose of kind of validating the experiences that caregivers are having. If you're having these challenges, many others are too, and so it's a good way to understand the challenges that folks are going through when they're in the respite system, and then different ways of how we can mitigate and to provide some support to these folks. So we do know that one of the primary concerns that caregivers have today is deciding whether or not to allow respite into their home. I mean, again, they have to think about the health and safety of everyone who's involved in the caregiving process. Adapting to those sudden changes of an onset pandemic. I mean, it's happened just like that. And, you know, how do you plan for something like that? So it's definitely taken all of us pretty much by surprise. And then having to go and explore options to reduce the risk of contracting the virus themselves. Okay, in addition to the fact that now we don't have opportunities for renewal and relaxation through receiving respite support. We don't have the ability to seek any pleasure, to get a break from providing respite care or from our caregiving duties. We don't have that break. We don't have the ability to go out and shop or just go and have a manicure, a pedicure, just so many things that the individual caregiver has to deal with, on top of, you know, not getting their needs met, on top of that now having to go deeper into pretty much crisis mode and trying to figure out and make everything work that's going on around them. So they're experiencing burnout from not receiving particular supports, and we understand that. And again, once we go into the breakout session, it'll be interesting to hear what other caregivers who are on the call today have themselves been experiencing. Additionally, these folks have experienced limited interactions with healthcare facilities, so not being able to go for those checkups or those regular appointments, or if they do, I mean, again, definitely taking into considerations all of those mandates and all of the extra added weight of navigating just going outside the house. I mean, it's just really been a very devastating impact on us all. And then their efforts to pursue, trying to find some kind of a break during this this time. And one of the challenges that folks have experienced is their access to technology to be able to communicate with others, primarily in many cases because a lot of folks lack computer literacy. So they're not able to utilize those technological resources that we have available. And then when they do, it's, the impersonal nature of virtual interactions, getting to know people, strangers, and different platforms, if there is technology available, and trying to find comfort in that interaction to kind of minimize their loneliness and their social isolation. So respite in action. So I went ahead and I looked at some of what some other states were doing, and it's a time for us to be really creative and innovative and thinking about various ways that we can survive or manage the difficult process that we're in. So in Indiana, there has been recommendations for caregivers to make sure that they're maintaining contact with administrators, respite administrators, direct services professionals, as well as state resources, just to stay abreast of changes in policies and procedures, right? So new information appears to come out just about daily, several times a day, and it's important to stay in contact with those, with the respite community, to understand how you can, again, navigate during this time, specifically with respite, the respite community in mind. There are frequent updates, again, through the CDC, the World Health Organization, the Department of Health and Human Services here at the state of Nevada for you to contact. And I have these resources, contact information available for you later. And so that just goes to the last point here, is to feel free to reach out to state agencies. We're here to serve you. We have put a number of things in place as a result of the pandemic, including emergency initiatives to serve all Nevadans in whatever state they're in. And in New Jersey, the statewide respite network implemented screening procedures. And so, find out what the recommendations are from the Nevada Coalition in terms of procedures. For instance, in New Jersey, they did implement a screening procedure to ensure that PPE was available, or where those resources, those PPE resources were available. And also within 24 hours of a potential meeting or a potential service delivery, assess each and every person who is involved in the process, be it the caregiver, be it the provider, be it the individual receiving respite services, other family members, definitely assessing that whole 360-degree view or climate of where that service delivery will take place. And so I think that's a really good idea. And I'm not sure if we're doing it here in the state of Nevada, but they are doing it in New Jersey. And that's just that ongoing assessment and checking in with folks and seeing how comfortable they are with respite at the time. So how do you receive access to respite, whether you're a provider or a caregiver? These are some considerations. Again, sounding like a broken record. There's nothing new. I mean, for this virus, there's nothing new. It just there are recommendations that are given that we can't, for the most part, take shortcuts, right? So we want to be able to do what we can and be as aggressive as possible to minimize the spread of this disease. So again, respite care providers should not provide care if they have developed symptoms or if they've recently been exposed to someone who has been diagnosed with COVID-19. Carefully follow the recommended guidelines, policies, and procedures that include social distancing and staying at least 6 feet away from others as much as possible, wearing those cloth coverings or other PPE as needed, washing hands and cleaning and disinfecting regularly. So that is just, there are no other answers at this point where we are. This is our current new normal until such things that we see through staying in touch with those government entities and agencies. These are the things that we're dealing with right now. But again, making sure that we're staying in touch so that we can be further apprised as changes occur down the line. And we do anticipate changes soon, but in the meantime, we've got to be consistent with these current mandates. So for caregivers and recipients, again, let your respite care provider agency know, or if you or anyone in the household has symptoms or have been recently exposed to someone who has been diagnosed with COVID-19, engage in social distancing. It's the same answer for all of us. Okay. Moving along, let's talk a little bit about social isolation. As Cheryl Donnell talked about social loneliness, and there is a difference between social isolation and social loneliness. So social isolation is a state of complete or near complete complete lack of contact between individuals and society. So that's just not internal, it's external. And so that external begins to compound what's going on internally as it concerns loneliness. You just don't have the ability, even if you wanted to go out and socialize or interact with others. So you're isolated. And that sense of isolation reflects or manifests itself again with the lack of contact with others. And it can be an issue for individuals of any age. We're talking about the lifespan, whether these caregivers or providers are younger or older adults. The experience is the same, but the symptoms may be different. So some of the symptoms are deep boredom and general lack of interest and withdrawal, losing interest in personal hygiene, poor eating and nutrition, significant despair, cluttering and hoarding in the home, being stuck inside the house. I mean, what do you do? I mean, you're just limited, you're isolated, you don't have much ability to do anything. And so then the result, again, comes from the barriers due to social distance guidelines. So moving forward, we know we're in a state, this is not new information, but what we wanted to provide today was some of the things that are offered that folks may not know about that may be able to support them during this time of a crisis situation among us. So in the state of Nevada, we have Nevada 211. 211 is a statewide resource of information for just about anything that an individual is looking for. You can dial 211. You can go to 211.org, Nevada211.org online and do a search for various service providers. One of the things that we've done in the state of Nevada is we initiated a project called Nevada Can several months ago when we were initially placed on social isolation. And Nevada Can is a resource that is actually transitioning into the Nevada 211 system to provide those resources from various partners that we have online today, other partners and resources that are out there that folks may not be aware of, but could be critical to helping them sustain themselves during the time that we're in. And so what we did with Nevada Can was that we did developed several action teams. One of the action teams was called the Social Support Action Team, which is designed to provide opportunities to interact with others with the use of technology. And so if folks have been impacted by the isolation and loneliness, there is a resource through the state of Nevada that not only will engage you using technology, but it will also teach you how to use technology if you don't have that ability. And in some cases, technology can be provided for individuals. For instance, an iPad or a tablet or something to be able to connect with others. So that resource is available right now out there. And I encourage folks, if you are lonely and isolated, a good remedy for where we are right now, we don't have any other choice, but we do have technology. And so it's time to learn about using technology. It's time to utilize it to the best of your ability to get your needs met, including those needs of loneliness and social isolation, and building new relationships with folks across the state. I mean, it could be very beneficial for the person who just needs to relieve some of the stress of the pandemic crisis on their lives. Then we have the Centers for Disease Control and Prevention. We know that's a federal agency. They have all of the responsibility of working to protect the safety and health and security of all Americans, and looking at how those challenges around the world can be impacting us from a disease perspective. So reaching out to CDC and staying abreast to what their recommendations have been. And then we have the Nevada Health Response, which is an effort again to keep Nevadans apprised of changes that are occurring, successes and legislation, and just so many things around our ability to stay connected with the most accurate, up-to-date information, especially as it concerns us here in Nevada. And then we have the Department of Public and Behavioral Health, which is aimed to protect and improve the physical and behavioral health of Nevadans. And of course, as you all are familiar with the ARCH, National Respite Network and Resource Center, they have all of the up-to-date information as well to help you navigate through this crisis that we're in. So we are all in a situation we wanted to end right away, but for right now, this is our new normal, and it's definitely taken a toll on us. But we've never done this before, and so it's understandable that we are having challenges. So specifically with reference to moving to a new normal, the state of Nevada remains in the response stage to the COVID-19 pandemic and will be for the foreseeable future. Okay, so to be successful, Nevada has developed a sustainable response model, one that will allow the administration to utilize all available state and county assets in this response and recovery effort, and maximize consistency and accountability, and prioritize the communication of the state's most accurate data to the public and to decision makers. So this is a natural evolution of the state's response. What else can we do? And one that recognizes the need for deliberate and predictable response to the protracted crisis of a global pandemic. So that's where we are right now. We encourage you to spread the word about what we've talked about today. You know, we don't have much new in terms of what we should be doing, but we know that we are given the same information. The recommendations have not changed. We are urged to acknowledge that we have never been in a situation like this before, and our mandates and the direction that we're getting from our leaders is the latest information for us. So to answer ultimately, is it the new normal? Again, for right now it is.